Hola, ¿qué tal? Mi nombre es Luis Martínez. Me da mucho gusto darles la bienvenida a esta nueva plática con líderes en salud global. En esta ocasión tenemos oportunidad de platicar con el doctor Vikram Patel, quien es uno de los exponentes más importantes en salud mental global. Sin duda es un tema de gran relevancia durante esta pandemia de COVID-19. Y antes que nada, quisiera compartirles un poco sobre el invitado que tenemos el día de hoy. El doctor Patel es un médico psiquiatra originario de Mumbai, en India. Tiene una gran trayectoria académica y podemos destacar los estudios que ha realizado en la Universidad de Oxford y en la Escuela de Higiene y Medicina Tropical de Londres. Y en esta última universidad, pues fue fundador y director del Centro de Salud Mental Global. Y en la actualidad, el doctor Patel es el profesor Pershing Square en Salud Global en la Escuela de Medicina de Harvard. Y además es cofundador de la ONG Salud en India, en donde enfoca su investigación en el desarrollo infantil, en salud mental de los adolescentes y en terapias psicosociales. Doctor Patel, hi, how are you today?
I'm very well, thank you so much, Luis, and I'm joining you from Goa in India, where I'm currently locked down.
Fantastic. Well, we are living something similar here in Mexico these days, and well, thank you for giving us some minutes of your time in these difficult times. But before starting with some questions for you, I would like to ask you first if you can talk about yourself. Who is Vikram Patel?
Well, I'm a psychiatrist. I trained in medicine in India, and then I went to England in soon after medical school to Oxford University, where I did my first research degree. Then I trained in psychiatry in the UK, and then I worked in a British academic environment right up until 2017. But during this 30-year period, I was mostly based outside Britain and developing my skills in public health, and particularly global health. First in Zimbabwe and then in India. And in 2017, I joined Harvard Medical School. But what I really am is I'm a great passionate believer in the power of communities to identify and to solve their own health problems. I'm a great believer, even though I'm a physician and I've been trained in the best medical schools in the world, and I work in one of the best medical schools in the world. I genuinely believe that most healthcare must happen in the community, and I am a great believer in the power of community health workers. And I hope that is something that we'll talk a little bit more about in this conversation.
Thank you, Professor. Yes, of course, the community has a huge importance in what is happening actually to them in these dynamics. But first, perhaps we can start talking about the concept of global mental health. This concept has become very important in recent years, and we have seen significant progress in this area. However, there are still pending priorities. What do you consider to be the current main challenges for global mental health, including those that COVID-19 is exposing right now?
So it's important to remember that global mental health is really a discipline of global health. And the core principles of global health are around reducing disparities or inequalities and access to good quality healthcare, as well as preventative interventions, and ultimately reducing the inequalities in health outcomes in populations. And a lot of the focus of global health has, of course, been in the inequalities between countries, and therefore a lot of global health emphasis has been on low resource countries. But let's be very clear. Disparities also exist in wealthy countries. And for me, global health is a subject that is relevant in all countries, unlike international health or tropical medicine, which was very much more about the health of people in developing countries only. And global mental health is simply the application of these principles and ideas to the specific area of mental health problems. And I think in the mental health space, for me, the most important priorities, number one, are that we do very little prevention, even though we have very good ideas of the important etiologies, the important risk factors for mental health problems. We don't use that knowledge very effectively. Secondly, we do very little in terms of community-based delivery of interventions for mental health problems. And thirdly, we do very poorly on challenging the stigma and discrimination against people with mental health problems at all levels of the healthcare system.
So, of course. Well, in recent interviews, actually, you stress the importance of considering physical, mental, and social well-being as joint elements, rather than just to refer mental health. I believe this we can see how the importance of approaching these elements collectively. But can you elaborate more? Why is this important, and not just see the concept of mental health as just one part of the public health problems that we are seeing?
Well, the truth is, Luis, actually, unfortunately, we rarely ever see the mental health of the person in public health care or primary health care. We only ever see the physical health of the problem of the patient. And I think, what I would suggest, the really correct way to think about healthcare is that it should be person-centered, which means that it addresses the issues that the person thinks is important rather than an issue that is defined on the basis of a medical diagnosis. What doctors are really interested in is diagnosing the person with a disease. What people are more interested in is to sort out their health problems. And in people's understanding of their health problems, they don't really so clearly distinguish the physical health problem from the way they feel, their emotional feelings, their behaviors, their thoughts. And all of this, of course, sits within the social world that people must live in and experience this health problem. And so I believe that the most perfect model of healthcare is one, sometimes people call it holistic or integrated. I just call it person-centered, where a physician must work as part of a team that includes, for example, a counselor, it includes a social worker who can ensure that a person's social, psychological, and physical health concerns are addressed concurrently so that we get the best outcomes.
What has been your experience working with in this community level in all these settings just to approach these problems?
So first of all, I have to say community health workers don't exist in Britain. There are other kinds of community teams, but they're all professional providers. I mean, there is one element of non-professional provision in the form of peer support workers. So to be fair, actually there are much more mixed teams of providers who work in Britain. But my main experience has really been in India, and I think here my most important lesson has been that with appropriate training and using language. And language is very important. Language that is locally meaningful. And but let me give you a practical example of that. Instead of going in and training a community health worker to say, we're going to diagnose a mental illness called depression, and instead you turn that around and say, we're going to work with people who are having very difficult personal lives, because of course most people with depression fit that description. People who are having a lot of physical and psychological symptoms as a result of those difficulties, like for example, living with a violent partner or having extreme economic difficulties. We're going to understand how we can help these kinds of people get better. And immediately the community health worker says, absolutely, this is something that I see all the time in my work, and I want to understand what is the problem and how I can help that person. You see, the whole language issue is very important. I'm not using a psychiatric diagnosis that is often associated with fear, with stigma, and also the idea that this person is going to have to get medication, which a lot of people don't really want to take. So I have found that by carefully adapting language, by ensuring that I'm working in a very systematic training program, community health workers they embrace the idea of mental health care. I have never encountered any form of stigma. And indeed, for the person who's receiving the care, it's also much less stigmatizing than to have to go to the big city psychiatric office.
In your experience, of course, what are the best strategies to go forward, to advance in order to change this system from a centralized system to a decentralized system and start working, as you mentioned, with all these elements?
So first of all, it's important to acknowledge that the idea of decentralization is central to global health, not just global mental health. Yes. The idea that people's health belongs in people's hands, which is a kind of slogan that has its origins in a wonderful book I read a long time ago. It was really a book about community engagement, participation, and empowerment in all matters to do with healthcare. For me, this is a foundational principle of global health, and not just global mental health. In the specific area of global mental health, one of the very important, and I think perhaps unique to global mental health, one of the very important strategies is the engagement of people with the lived experience of mental health problems. And this is especially true for serious mental health problems. This is a group of individuals who are very vulnerable, very stigmatized, marginalized. These are often the people who you'll find are living on the streets, or they may be incarcerated in prison, or in extremely awful mental hospitals that are, leftovers from colonial times. These are a group of people who are often involuntarily treated against their will. And what we need to be seeing is a lot more empowerment in the genuine sense of the word empowerment, where they are in fact in positions of making decisions, planning the kind of care that they want, they want, and holding care systems accountable. And I think that is a very particular kind of strategy for global mental health in terms of decentralization. The moment you say it's the consumer, the user of service, who actually holds power, then automatically you decentralize.
Of course, and this principle works with actually different kinds of diseases and situations regarding to health. Well, now that we are in an unprecedented time, what is happening with COVID-19 right now, how the COVID-19 pandemic is impacting the well-being and society, and in particular for health professionals, Professor?
So first of all, I want to say that in the acute crisis, my biggest anxiety is for health professionals, as well as for people who have mental health problems. Because for people with mental health problems, the COVID-19 strategies have often meant that their regular care, their routine care, has been stopped or interrupted. And I think this is very unfortunate. And of course, this applies to all chronic diseases, whether it's cancer care or mental health care. It doesn't matter. The point is, we must not allow the focus on one disease to displace essential care and services for everything else. So that's a general principle. For healthcare workers, I think this is particularly in places where there is a lot of sickness and death. And I know in the US is a good example of a country, parts of the US anyway. Clearly, my colleagues in the Harvard medical system, I know that many of my colleagues have sought counseling support in an environment which is not going to be stigmatizing, where they feel comfortable doing that with a professional counselor. And I think certainly making those sorts of mental health support services available. But I think we should distinguish this from mental illness. When you see a lot of death and there's a lot of anxiety, of course, there is going to be a normative human response to that. And we should be careful not to medicalize that, because those are not mental illnesses. Those are the natural human reactions to very, very unnatural circumstances. But what I'm really worried about, Louis, is what is going to happen in the months and years ahead as the economic recession, which is probably the biggest economic recession in the last 100 years, is going to start biting into people's lives. That uncertainty, the impoverishment, the social disconnectedness is something that I worry about a lot, because those are exactly the ingredients for the emergence of mental health problems and substance use problems. And I think, we've already seen after the 2008 recession, the increased mortality due to suicide and substance use disorders in the US. And I fear very much that unless we plan now to really strengthen an already very weak mental health care system, which even before COVID-19 was very weak, we're going to see a completely different kind of epidemic, an epidemic of deaths due to mental health problems in the years
ahead. But what about health professionals? Are health professionals living different situations, mental health situations, than the society?
Well, I think health professionals are, first of all, members of society. So, of course, they're as vulnerable to all the stresses and anxieties that any other person in society has. But I think health professionals have additional anxieties too. Obviously, those health professionals who are working in COVID-19 care contexts, the actual fear of contracting the disease and then taking that illness, even if you're asymptomatic as a young practitioner, you might live with elderly relatives, and there's a constant anxiety about, what the implications of that might be for their well-being. So I think there's that anxiety in a few places, and I would like to stress it's only a few places where there's been a huge volume of very sick people coming in. There's obviously the additional grief of seeing people die in numbers that you've never seen before. And this is especially true of Europe and the US, where death is a rare occurrence in hospitals. Not so true, I have to tell you, in India or sub-Saharan Africa, where death is a common occurrence in hospitals. So I think if you're not accustomed to seeing death in this kind of scale, it can be extremely demoralizing. And I've also been hearing about colleagues who've had to make awful decisions, for example, about allocating resources that are scarce according to what they think might be a better a chance of survival, and so on. So I think these are much more stressful. I will say one more thing that's very peculiar to what I've seen in India is that some of these health workers have been stigmatized because they've been dealing with COVID-19, and when they've come home at night from work, some of their neighbors have actually said, "Don't come into the building. You should go and stay somewhere else." And that's the saddest thing of all. Healthcare workers who are actually on the front line of the
Yes.
epidemic being stigmatized. And in part, Luis, it's because of very poor communication by our governments. There has been a complete catastrophe of bad communication. For example, communicating risk properly, that this is not a deadly disease for the vast, vast, vast majority of people. And that with simple things like covering your face with a mask and washing your hands, etc., even that small risk can be reduced even further. Instead, what we have done is instill the fear of death in people's minds. Unless you're an epidemiologist and you can read all these and understand all these, mortality rates and so on, it is very difficult for the ordinary person to understand exactly the truth. And people have reacted with these lockdowns and so on, thinking this is the deadliest disease that has ever come on our doorstep, and we are all at risk of dying. That has been also very harmful to people's mental health.
Unfortunately, we have seen this kind of violence from not all the society, but some parts of society for health professionals. We don't have, as India here, the model of community health workers as it works in some countries in Africa and in India, for example. But we have seen this behavior from small parts of society attacking health professionals, nurses, physicians, and we can see the reason of that. In your recent interviews, you also talk about the fear of misinformation, the stress of uncertainty, and physical distance as the key elements of perhaps what is affecting the most in society. So can you perhaps address these concepts also?
Yeah, no, absolutely. I think you said it right. I mean, I think if you think of what affects our mental health, it's fear. And in this instance, fear has been largely produced by badly communicated information, incorrectly communicated even, about the risk that the virus poses. And about how one can actually protect oneself. Instead of sort of saying we've got to always stay indoors and never leave the house and never see anyone, you could have actually said things that are much more easier to practice. For example, physical distancing when you're in a shop, wearing masks and so on. Instead, we've terrified people. So fear. The second is uncertainty. And uncertainty here has many levels. Uncertainty about when will this epidemic ever end. You're getting mixed information from different groups of scientists. One group says this, one group says that. It is very confusing. The uncertainty about whether or not the economy will survive. And for many people, the uncertainty about their own personal jobs and livelihoods going forward. Fear and uncertainty. These are two very toxic factors that affect anyone's mental health. And the longer this continues, the worse is the impact on one's mental health.
What do you recommend to address these problems? I mean, we are seeing this, and perhaps we can act from the policy and public health level, but also from society and people that is not help, people that are not health professionals that are seeing this interview today. What is your recommendation for them?
Well, first of all, I wanted to say one more emotion that I think a lot of people are feeling is anger. Anger that they're being lied to, anger that they're being forced to do things that they don't agree with, anger that now, as some of the impacts of the economic recession are becoming apparent, that people made the wrong choices at the beginning. I mean, there's a lot of anger, and anger is another very harmful emotion when it comes to mental health. So if I was in a position of giving advice, I would say going forward, get the messaging right. Make sure the information is presented in a positive, empowering way. Secondly, engage your population. Build trust. Trust is at the center of ensuring that people work in solidarity with each other. This is not about imposing rules and making this a law and order problem. This is about engaging the whole of society in a collective action towards controlling the pandemic. Thirdly, make sure that whatever you do, routine healthcare services are not interrupted for anything, whether it's the common cold, whether it's cancer or mental health care. Fourthly, make absolutely sure that you're allocating resources not only for ventilators and intensive care, but also for those people who are now going to go hungry because they do not have an income every day, because hunger will also kill people. Hunger is also something that leads to diseases. And so I think this is what government should do. And of course, the fifth I would like to emphasize, I said it earlier, but I want to say it again, is make sure that when you think of the health sector response, you're not only thinking of hospitals and doctors. Remember that 95 to 99% of people with COVID-19 will never need to come to a hospital. What they need actually is maintenance and support in the community. They need to understand the importance of isolation. They need to be able to trust the community health worker. And that is where 90% of our energy should be.
Fantastic. Professor, just before ending, well, many of the viewers of this talk are actually young professionals, mainly from Mexico and Latin America. What message would you like to give them today?
Well, I hope as a young health professional, you can see how important it is, the job that you do. For very rarely in society do you find a health issue that becomes the most important, in fact, almost the only issue that everyone is concerned about. This is one of those moments in history when that's happened, and you can see how important it is to become a doctor, a nurse, or another health professional.
Well, Professor Dr. Patel, thank you one more time for giving us this space today to talk about all these concepts. This is really, really important, not only due to the COVID pandemic, but thank you one more time to helping us to understand all these concepts and all the tools and strategies that we have to address all these problems quite well, from the policy level, from the political perspective, and of course from society. Thank you one more time for this space. And well, from the Mexican Society of Public Health, I want to also wish you, your family, and all the team at Harvard, well, our best wishes.
Well, thank you so much, Luis, and the very same to you and your family and colleagues and friends. Thank you so much. Bye-bye.
Have a good day, Professor. Thank you so much for your time.